Hey class, welcome to week 2 of our anesthesia lab assessment. This is going to be pretty much an introduction to week 1, what we've learned. Pretty much what I'm going to have you do is go ahead and follow all of these tasks on my assessment sheet. So pretty much it's the same thing with week 1. It's pretty much going to go over the overview of the whole entire machine, the components, and what exactly they're called. So we'll go ahead and get started. So the first thing I'm going to have you do is turn on the anesthesia machine. Second thing I'm going to have you do is attach the breathing circuit. Now, when you get over here, there's going to be 5 components of the breathing circuit. So you're going to have your corrugated tubing, you're going to have your reservoir bag, your sample line, your elbow, as well as your mask. So the first thing we're going to do is we're going to go ahead and connect our corrugated tubing like so. Going to connect one to the expiratory side, one to the inspiratory side. Then we're going to go ahead and take our elbow, attach it to our mask, get our reservoir bag. Going to put our reservoir bag right there. Then we're going to put our elbow and mask on our corrugated tubing. Last but not least, we're going to take our sample line right here. We're going to put it into our defend or water trap, which is connected to the gas analyzer, which then goes into our elbow. Okay, now we see that our anesthesia machine's on. So now we're gonna sit here and we're gonna make sure that our suction is working properly. So with the suction, guys, I want you guys to make sure that you have all your connections properly connected. So from the vacuum, it's gonna go all the way to the back of the machine here. And then you're gonna have your tubing that goes from your patient side all the way to your yank hour, which is this one right here. And what I'm listening for is that sound to ensure that it's actually on. So we hear it, we verify it's good, it's working properly. So now we can put it back in there. Next, what I want you to do is locate your flow sensor. So what you're gonna do is you're gonna come down here, open our tab, pull it out, and your flow sensors are going to be these 2 plastic pieces here, which are attached to these sensors here. That's your flow sensor. Next thing I want you to do is locate your O2 sensor, which is right here. Untwist it, look at it, it's good to go. And then we're going to plug it back in. So now we can go ahead and put our flow sensors back in. Close it back up. Good to go there. The next thing I want you guys to do is locate the bellows. So the bellows are right here, and what the bellows do is they drive the oxygen and anesthetic gases to your lungs. Think of it as an artificial lung. Next, we're gonna go to insert and locate our anesthesia vaporizer. Right here, this is gonna be our anesthesia vaporizers. Specifically to this machine, this is called the Aladdin cassette. So what you're gonna do is take it out, then you're just gonna pop it back in, twist the knob, make sure it's seated correctly. Next, we're gonna locate our gas analyzer and water trap. So this is our gas analyzer right here. This white piece, this whole white piece is your gas analyzer. This right here is your water trap. The water trap basically collects all the moisture that comes from the sample line, and the gas analyzer is responsible for reading all the anesthetic gases as well as your O2 and any of the volatile gases that are in your body. So it'll give a MAC display onto the screen, but we'll get into that later into our more in-depth assessments. Next, what you're gonna do is you're going to find your APL valve. So this is your APL valve right here. It stands for adjustable pressuring limiter. And basically what this does is it opens and closes your reservoir bag and gives you positive pressure, so that way you're able to bag ventilate or positive manually ventilate a patient. So in the minimum position, that means it's open. Think O for open or 0 for open. And then when it's closed, it's all the way on 70. And then that's partially closed. So we're just gonna go ahead and open it all the way. So that's gonna be our APL valve. Next is going to be your O2 flush valve. O2 flush valve is here. As you can see, our reservoir bag is going up. Basically, that just supplies the patient with fresh O2 to their lungs. Next, we are gonna locate our soda sorb. our sotasorb down here. So to take it out, you push this green tab. I'm gonna make sure that it's not exhausted. If it's exhausted, it's gonna be purple. And then you would just slip it right back in here, right over these two little notches. It's good to go. All right. Now, our next task we're going to do is we are going to make sure all E cylinders are open and closed. So you're going to come to the back of the machine. Here's your oxygen or your O2, your air, and then your nitrous oxide would be here. So basically what I'm looking for is that we're going to open and close. Open, or open, closed. Open, close, and you would do the same thing with the nitrous oxide. Next thing we're going to do is we're going to check and make sure all our anesthesia hoses are plugged in. So you have our oxygen, you have your air, and then you have your medical vacuum. There you go. Then we're going to come back over to the front of the machine. And next, we're going to start the anesthesia case. So we're going to press start case here. Next, we're going to sit here and look at the parameters. So I might tell you, hey, this is an adult. You leave it on adult, but if I say it's a pediatric, you would just change it to pediatric. So I wanted a pediatric, 5 years old. Okay, we're good to go. So we're going to go ahead and start case. And then I'm going to ask you to select the mixed gasture. So right now we're on 100% O2 mixed with air. So if I want a 50% combination, I would just tell you to select 50% of O2. And as you can see here, we're mixing our air with our O2. So pretty much I'll tell you a specific oxygen concentration I want you to do, and you'll just have to select from the menus over here. Next, I'll ask for a total flow. So if I want 10 liters a minute, I'll have you dial it up for 10 liters a minute. If I wanted at 8 milliliters a minute, 8 liters a minute. Click confirm, and so on and so forth. Next, I'll tell you to turn the anesthesia gases on. So it's off. Say I tell you I want it at 5%. There's no 5, right? So what are we gonna do? Just hit 6, and you use the selector switch to turn it up and down. Hit confirm. So now that's good to go. So the next thing I'm going to ask you to do is switch from bag to vent mode. So you're going to hit your selector switch to vent mode. Now you can see all of the parameters for the ventilator are on. So what I'm going to say is switch the mode. So if I tell you to switch the mode from pressure control to volume control, all you're going to do is press volume control. Now, say for example, we're going to set the tidal volume to 160. Good to go. But now I want to be back on pressure control. Switch it back to pressure control, and I'll dial in whatever pressure I want. So basically, this is going to be the mode, either pressure or volume. So we're going to switch it back to volume control. I'm going to tell you to put the volume in. So if I tell you 500 of tidal volume, put 500 mils a minute. Confirm. Respiratory rate, we'll say I tell you to say 12. We're going to set it at 12. IE ratio 1 to 2, I tell you 1 to 4. And how you would do that, you would just adjust the dial 1 to 4. And then we're going to do PEEP. Say I tell you to give them a PEEP of 4. Start off at 4, and then we selected it. Now, PEEP stands for positive end expiratory pressure. And what PEEP is, or what PEEP does is, it expands your lungs on the expiratory breath to keep your alveoli open and to keep your lungs from collapsing. Your respiratory rate is pretty self-explanatory. It's how many breaths you're getting per minute. Your tidal volume is a total volume of air in your lungs that we're gonna mechanically vent you with. And then obviously we have the mode, which is gonna be either volume control or pressure control. Other than that, that is probably gonna be the conclusion of the test. And then, like I said, this is going to be completely done on your own. So you're going to have to study the material and look over the video or look at the assessment sheet to kind of pinpoint it and get it down. Other than that, good job, and I hope to see you guys next week.